Hi, my name is Rob Gordon, and if you found your way to this video, it's part of a YouTube channel I'm just now setting up. It's called My Mental Health Journey Horror Story. It's about some criminal activity I witnessed and was a victim of at family healthcare centers of San Diego. This particular video I'm making right now, though, I want to be really quick and dirty because I've been doing a citizens investigation of this organization, of course, to exonerate myself. They made some really incredible false accusations against me. So in doing so, I found some information that's really relevant to what's happening with me. And basically, in a nutshell, they are reverse diagnosing adults who have been successfully diagnosed with ADHD. They are reverse diagnosing them, cutting off their medications abruptly, and diagnosing them with something else, I guess. In fact, I know. This is really scary stuff. Anybody looking at this that's in an official capacity, like the medical board, you need to take this seriously. So like I said, this is a quick and dirty message. I just want to go through the letter I'm sending to the medical board, not in detail, but just the outline of it, because it's pretty conclusive proof of what's going on, and it's pretty horrendous. So I'm going to share this and just show you the letter and kind of a little bit some of my thoughts on it. So here's the letter. And like I said, I'm just going to go over the gist of it. It was written to Shelby Chaplin at the Medical Board of California almost a month ago, but they keep coming back at me and saying, first, they couldn't read the images in it. So I put it in a Google Doc, shareable, and then they couldn't read the Google Doc. They weren't allowed to. It started to seem pretty insular over there at the medical board. I'll have more to say about that later. But real quickly, Claudio Cabrillos, I had a session with him, I think it was almost 5 years ago. I was really having a hard time. He was the first psychiatrist I had ever seen. And I went in there. I didn't know at the time that I had ADHD. I knew it was an attentional issue. I know now that I was giving him a textbook case of ADHD. But he had some kind of script he was going through. Some of it they have to do, were you abused as a child and that kind of thing. But it just seemed like he wasn't listening or didn't care about what I said. And I made it clear that this was not just some new thing. This is my whole life. I was having this kind of problem. And he said, well, you're probably just depressed or something like that. And I argued with him. I said, no, I don't think that's this. He goes, well, did you feel depressed sometimes? I go, yeah, I guess. He goes, well, then you're depressed. He quickly wrote out a prescription, I think, for Xanax. I remember I looked at the clock because I had waited a long time for this. And by the way, guys paid like $500,000 a year. And I know it was no more than 25 minutes. I'm positive because I looked at my watch and I actually saw him rushing down the alleyway. He was late for something, and I was just an annoying patient. When you're that rich and you have infinite supply of customers, I guess that's the way you treat people. But I would just remember thinking, and I'm holding the prescription in my hand. I remember thinking that it was dystopian. It was, oh my God, they're just drugging people that have problems now. Turns out I was right, but I'm going to cover that later. Quickly into the letter. Here's another one, slightly more damning. Sorry, this doctor may be good for Spanish-speaking individuals, but it's a prime example of below-average Medi-Cal doctors, very uneducated and poor thought processing. I don't know if that is true, but I mean, he didn't do any thought processing, so yeah, I guess it was poor. I wouldn't recommend. Biggest problem is the individual needs to examine the history of medications on a client-to-client basis and not make decisions based on what non-continuous staff members at family health centers delegate. Oh, right on. There's no name on here, but whoever wrote this, thank you. To be disgusted with the doctor's behavior would be an understatement. So disgusted is kind of a strong word. People don't always use that, but he's alluding to an important fact. People at family healthcare centers, I had a successful ADHD diagnosis. I had a low-cost, highly effective mental health treatment. I was only seeing my psychiatrist once every 3 months. Everybody was happy. That came crashing down one day when you're going to hear that story. Um, but they do this, oh no, we'll do a different diagnosis. Your previous guy was wrong, but I'm king, I'm God. They'll do it after like 5 minutes. Okay, here's where we're getting into. I'm not going to go over what I said here, but here we're getting into kind of the gist and sort of getting close to the time frame. This is the worst healthcare company. Today was the last straw. I first came to this office to see mental health doc Cabrios, who insulted me because I'm on medical. I believe that. They're just, these people don't even know how degrading they are. And saw me once and made an assumption that I don't have ADHD. How did you do that, dude? She's living it. What is wrong here? What is wrong with this picture? My prior mental health care provider office closed down. Unfortunately, I need to see someone. So they did this to me too. They kick you off meds. I tried another office, but it seems like this place hires nothing but heartless psychiatric. Well, they're not heart. They just heart. Well, yeah, they are heartless, but they don't think you're a human. They just they think you're a drug addict or anything. I'm a mental health care patient. You can't be playing care with my treatment, but they do. They fuck people's lives up on a daily basis. You can have a lawsuit soon for not treating your patients. Miriam, I hope you did that. The lawsuits they used. They're really vicious people. They have unlimited government funding. I think I'm not going to go into the cheating law for Mulvaney and Associates right now. They're dirty players. However, I still encourage you to file your lawsuit. Even if you lose, at least it gets on their record. At least they spend money, even if it's government money. Hopefully someday someone will notice. Okay, now we're getting closer, not just closer. We're in the neighborhood of exactly when they did this number on me. This man goes by the name, is his name probably, Abdullah last name. So I received the telehealth for mental health. There's Dr. Claudio Cabrios, who is very smart, kind of the opposite of the other guy said, but he is so anti-controlled substance. I've seen a doctor before him named Dr. Urbe Joseph, Edward Urbe, I believe. Well, Dr. Urbe. Who was my psychiatrist, who was very good, saved my life really. Prescribed me Adderall, the same dose. That's a low dose. This guy's too, but Dr. Claudio is so anti-controlled substance. We must not forget, for some people, and abused. He's talking the medicine for some people and abused drugs for others. Well, he's making the point that a stimulant medication does something totally different to adults with ADHD. I can go to sleep on it. It's something. Another. We'll go off on that later. But what's clearly happened here? He's been undiagnosed. He has racing. Okay, he does have ADHD. Tries to contact someone to talk about, and they just don't bother. Typical. That is a smoking gun. Now let's go to this guy. Very well written post. I have talked to Mr. James on the phone. Listen to this post because this is very close to my story. I was assigned a new provider. I was immediately taken off my ADHD meds, but my antidepressant medication was increased. Great. Now, as my entire life, financial, social world crumbles, and at least in a few weeks, I won't be depressed about it. Nothing I can do since I'm on Medi-Cal. I've made every possible appeal to me and have been ignored. I think these folks are trying to be all things to all people, and it's beginning to show. If you have a mental health issue, the maximum amount of time is around 10 minutes with a provider. That's barely enough time to say hello and answer the questions about suicidal tendencies. Then they write or stop a prescription with little regard to how that will actually affect the life of the patient. So right on. And everyone who may come in contact with the patients. In legal terms, I think that may be called careless disregard. This guy's a really good writer. That's very much my story. He's had a great med here. Meds can change your life and change it back. Prescribed a med that turned life into a success. Boom, he leaves. Assigned a non-doctor. By the way, I don't think I've ever had. I was there since 2014. I don't believe I've had a real doctor yet. Since then? Okay. Prescribed a med that turns my life into a success. Boom, he leaves. Assigned a non-doctor. Takes that medication away. Boom. Within 30 days, business fails. Lose housing. Living in an RV in a alley. Oh, Family Healthcare Center Psychiatric Department, heck of a job. Let's see, Myra Ruby, the director of the mental health department at Family Healthcare Centers. Your first job you've had in your life. You're kind of blowing it, Myra. Anyway, boy, they've done a number on this guy. Maintaining continuity of care. There's no such thing as continuity of care. You're just a billing entity. Yes, I'm resentful for knowing my potential and having it ripped from under me. I know exactly how he feels. They did that exact same thing to me. It's as if I was to visit a fine resort and throw it into an exit in the alley. They really should not treat people with ADHD at all. They should refer them elsewhere. They did increase my antidepressant, so I won't feel down about my life falling apart. I was taken off medications. I was told because of high blood pressure. They made that up. I am positive. These are compulsive liars at Family Healthcare Centers of San Diego, especially in the mental health department. But following a complete physical by their own staff, my blood pressure is great. Why did they do that? Because they need, for legal reasons, not as soon as you complain, even slightly, they go into legal mode and will attack. And they did. Do no harm. They did me harm. Wish I didn't know what I could have done. This place doesn't understand the concept of do no harm. I have thought that in the entire time I was with them. He sent me some private messages I'm not going to go into, except that he was ordered by the courts to have a psychiatric evaluation, but only after he complained. Wrap your heads around that. This is more and more like a Soviet-style system where the courts and the legal system cooperate with the mental health authorities, for want of a better word. And in this case, you've got a couple rogue people loose in your system, if that's the case. Joseph Pulvit is a compulsive liar and a con man. I don't know what to say about Cabrillos. I don't like the word quack, but he was incompetent, gave me a sloppy diagnosis, incorrect diagnosis, and I want to know what the hell he's doing coming back 5 years later, and having anything to say about me at all. So I'm going to close it up there. This is not a this last one I'm going to mention, though, actually provides no evidence whatsoever against Cabrillos, but I want to mention it. This one, Patty S. This place should be shut down by the health department. Right on, sister. The county is not doing its job. If this were a hamburger joint, they're poisoning people. If this was a little construction job, they don't have the supplies to finish the jobs they start. Shut this place down. Let me read her post. First of all, they have many fake Yelp reviews here because they're too lazy to make themselves better. I believe that. They have a bunch of tricks they use to hide negative reviews. But the rest of the complaint system is totally dysfunctional either. They don't know how to game it. So they just lie instead. They do. It's a culture of liars. They're just really horrible people. That happens in an organization by promoting bad people and kicking out good people. And they do that after exactly 2 years at Family Healthcare Centers. You're expected to leave after 2 years. Most people agree with that. They say this is a good place to start. So it's a machine. We've got a, what's that name on Dragons, that woman on the Mother of Dragons? We've got to smash this wheel. I'm not doing it myself. The mental health department treats you like they're better than you, all while providing the worst care I've ever encountered in my 62 years of life. So right on. Young lady here, I'm 67. I did call her on the phone. We're going to have lunch one of these days. Really interesting person. She has been a therapist. She's licensed. She knows the business. So she knows incompetence when she sees it. She recognized that they were using anger as a political tool, something I recognize from other evidence and myself. They make you angry, and then, especially the mental health, and then use that as evidence against you. They've actually documented it with me. I mean, they put that all in writing, showing anger. This is an organization that spits in people's faces every day and then blames them for being angry. Best example of that is their 1 minute late policy. People take travels, an entire day to travel to see them. 1 minute late, get the hell out of here. They do that for fraud. That lets them double bill. But this is proof. Family Healthcare Centers is reverse diagnosing adults who have been successfully diagnosed with ADHD. Thank you for listening.